Now that we're all ready, again, my name is Julie, and I'm delighted to introduce Karen Nielsen, who has joined us today to present on Medicare 101. Karen has worked in the Karen has worked in the Medicare insurance industry since 2012 and has her life and disability insurance license in Washington, Oregon, and Idaho. Karen was an inaugural board member on the Human Broker Advisory Council and is a member of the Senior Care Coalition, as well as multiple other senior advocacy groups. All right, so I'm going to go ahead and pass it over to Karen, and we can get started.
Thanks, Julie. Good morning, everybody. Thanks for joining the call. Like Julie said, feel free to ask questions as we go along. There are a lot of times I actually kind of prefer to stop what I'm talking about, check to see if there's any questions so we can all kind of stay on the same page. So, and I really do like a good Q&A session. I actually kind of prefer that versus me just rambling on and on and on. Because anybody that knows me knows that I can talk about Medicare absolutely forever. So. What I'm going to do is share my screen. What I like to do when I go through, I'm just going to give a really good overview about Medicare and what your options are, the two different structures in order to get your Medicare coverage, and kind of talk about a little bit about the opportunities that you have to transition onto Medicare or make any changes with your Medicare plans. So I take things directly from Medicare's website. I logged on to medicare.gov. Any of you could do that. If you go over to publications, you can download the Medicare and You book if you do not have it already. So I'm going to go ahead and share my screen, and hopefully this will happen easily. Let's see. Let me see if it works. Julie, can you let me know if it is popping up correctly? Can everybody see that?
It looks good.
Perfect. Okay. You can't see me, right? So you can't see me doing a touch on my screen. Okay, this is out of the Medicare and You 2021 book. And I'm just going to scroll on down because right a couple of pages in is where I want to begin. So can everybody see that okay? We have mutes off. So if anybody just wants to type in the chat, make sure that everybody's able to see the view.
It looks good to me, Karen.
What's that?
It looks good to me.
Okay, perfect. Okay, so what other are the parts of Medicare? Let's just start off with the basics. So you've got Medicare Part A, which is your, as simplistic as we can say, your hospital insurance. And then you have Part B, which is medical. So I like to always say your doctor services. There's other things that go along with that, but to simplify things, Part A is hospital, Part B is doctor. And then there's Part D, D as in drugs. So within these three components, let's talk about the three of them. So Medicare Part A, you become entitled to Medicare Part A when you turn 65, or if you're on disability. If you've been on disability for 2 years, you actually will qualify for Medicare. But Medicare Part A, if you've worked 10 years or the equivalent of 40 quarters, you will not have to pay for Medicare Part A. People ask all the time, I'm turning 65, I'm still working, do I have to apply for my benefits? Well, because Part A is something that you're going to receive if you've done that work time frame, and you're not going to have to pay for it, I always tell people you might as well enroll in Part A because it's just extra hospitalization coverage for you. It'll work alongside your work insurance. Part B, however, has a monthly premium. And so this year, the monthly premium for Part B is $144 and change. That's per month. So again, to the scenario, I'm turning 65, I'm still working, I still have my work insurance. I do not recommend people go ahead and get onto their Part B because you're going to end up paying for that, the Part B coverage. So then there's Part D, your prescription drug plan. That Part D, again, in that same scenario, and there are vast number of scenarios we can look at. But again, if I'm working, I'm turning 65, do I need to enroll in a Part D? Not as long as your work plan that you have is considered creditable coverage to Medicare standards. People get concerned about having a penalty. As long as you have that creditable coverage, you're not going to have a penalty for enrolling in your Part D past 65. Okay. Let's do the scenario of I'm turning 65. Okay, I'm turning 65. I don't have any other work coverage. I need to apply for my benefits. Okay, so starting from scratch, Social Security is the way to get your Medicare benefits started. Most people think you go to Medicare for Medicare. That would make sense to most of us, but you get your Medicare benefits by enrolling through Social Security. Easiest way, ssa.gov. Make sure it's that government site. And then you can go ahead and apply for your Medicare Part A and Part B benefit, okay? And Part D comes in place when we do an insurance plan. Okay, before I move forward, do we have any questions on those three parts? Anything in specific in there? Julie, I'll give it a second. You let me know because I can't see if questions are popping up.
Yeah, I'll let you know. So if you have a question, you can type it in the chat here down at the bottom of your screen.
That was a really quick and simple explanation. There's lots more to it, but that's pretty basic. Okay. Sounds pretty quiet, so I'm going to go ahead and move forward.
Great.
Okay, so your Medicare options. This is what gets people a little on the confused side, so I'm going to try and break it down for you. You have two different ways in order to get your coverage. You can go the route of what we refer to as original Medicare, or you can go the direction of a Medicare Advantage plan, which is also known as Medicare Part C. So let's talk about the first. So when you have original Medicare, you have your Medicare Part A and your Part B in place. And then, as this says, you can add a Part D. You are strongly encouraged to add a Part D, okay? You can also add a Medigap or a Medicare supplement plan. So a Medigap plan is an insurance plan that can fill in the remaining costs that Medicare does not cover. So a lot of people are familiar with the 80-20 rule. Medicare pays 80%. Your Medigap plan can come in and pay that remaining 20%. Just shy of a deductible for those people who are newly eligible to Medicare effective January 1, 2020. And I will touch on that later. If I forget, please somebody remind me and I'll explain that very confusing rule to people. So when you have original Medicare, Medicare is your primary. So Medicare is the one who gets to say whether or not you get to go have a service done. And the rule of thumb is if it's medically necessary, Medicare is going to cover it. When you go to the doctor and the doctor says, well, you need to have an MRI, we want to find out what's really going on, Medicare is going to let you have that MRI. And so Medicare Part A and B, when they're working together, are going to take care of that initial 80%, and your Medigap plan can come in and pay that remaining amount. I also want to say in the Medigap world, there's a variety of different plans at different premium costs. So you may be on one that can cover that entire 20%. You might be on one for a lesser premium that you may have a copay when you see your doctor. Depends on which plan you opt to get. But you'll also get your Part D separate. That's a separate premium each month for that prescription drug plan. And you want to shop that prescription drug plan based on your own individual need. So if you're not taking any medications, I'm pretty excited for 2021 that the state of Washington has a plan that's available to folks that is a whopping $6.30 a month. So all my folks who don't take medications love, they're protected, they've got their Part D plan, they have something in place in case they need it, but they're not breaking the bank to have that insurance plan. On the Medigap side, you're going to pay around, I would say, estimate about $200 for that plan. So your cost on the insurance can kind of vary when you have this type of structure. But let's talk about how the structure works. Again, I said that Medicare is going to be your primary, okay? That Medigap plan is going to be the secondary. Medicare makes that decision whether or not you can have that service. And no matter what, if Medicare is going to pay the amount, your Medigap plan is going to come in and pay that remaining. A lot of times I have folks who come back and they say, but the insurance denied it. When you have original Medicare, it's not the insurance that's denying it, it's Medicare. Okay. But most everything, again, if it's medically necessary, Medicare is going to cover. When you have this structure, you do not have to get referrals. You don't have to have a primary care physician in order to get a referral to go see a specialist. You get to go anywhere that anyone accepts Medicare. You don't have a network that you have to deal with. You don't have to ask permission. And your plan is going to work the same here in Washington, just like it would work if you were in another state in the US, okay? Always it's going to work the same way. Medicare is your primary, your Medigap would be your secondary. It's a little more expensive to have your coverage this way, but some people really appreciate the fact that they're in control of their healthcare, meaning they can go choose who the specialist is they want to go see. And it's a little easier to budget because you know every single month, this is the premium I'm going to pay. Whether I have an extended stay in the hospital for a 6-week time frame, or I just go in and see my doctor or have some physical therapy, you're always going to pay that monthly cost, that monthly premium. And you can have those, which nobody wants to have those longer hospital stays. But if you did have it, you're not going to pay anything outside of your premium. Okay. Any questions on that before I move over to Medicare Part C?
Karen, we do have one question.
Sure.
Kristen asked, hi, my dad has Kaiser through Medicare. Does
Okay.
he need Kaiser or can he just use a Medicare doc?
Okay, so no, he needs Kaiser. So if he's on Kaiser Medicare, he's on a plan, a Medicare Advantage plan, which we're going to talk about here right now. That should help kind of answer a few questions for you.
Great.
Okay. Anyone else?
Nothing so far. Oh,
Okay.
she says, thank you.
Okay, not a problem. All right, let's move on. See, this one can be a little confusing to folks, so I'm going to try really hard to simplify it. And it will speak to those Kaiser plans. So Medicare Advantage plans are the HMO style plans or PPO plans. And most of us on a work plan have PPOs. So we're kind of familiar how those operate, right? We have our networks that we have to deal with. So on Medicare Advantage, you still have your Medicare Part A, you still have your Medicare Part B, but your Medicare is being managed by the individual insurance company. So in Kristen's case with her dad, Kaiser is managing that Medicare, okay? Which means it's not the same rule of thumb of the 80-20, and it's not the same rule that Medicare is going to be the one who's going to say yes or no on a service. It means that individual insurance company is going to say yay or nay. So they do have to follow the guides that Medicare specifies. So they do have certain things that are required of them. But again, they're the ones that are going to give permission when it comes to having some of those services given. Okay. So again, for example, that MRI, no matter who your Medicare Advantage plan is, they're the ones that are going to give that authorization. Do they find it necessary for you to have that MRI? And I will tell folks that the reality is the insurance companies, especially those with dealing with Medicare, they don't want to deny an MRI if somebody needs it. So I never want anyone to have that misconception. However, you do need to realize that sometimes you might have a little delay because you're getting that, you need to have that authorization before you have the service. Okay. But Medicare Part C, again, it takes Medicare A, B, and D. Your prescription drug plan is typically rolled into a Medicare Advantage plan. And somebody somewhere along the lines decided to confuse us and refer to it as Part C. So on Medicare Advantage plans, they operate differently. You typically are going to have a lower premium up front. And a lot of times you're going to have that zero, there's a $0 plan available for most carriers, which, you know, that's kind of nice, right? I can have insurance and I don't have to pay for it. But I always let people know you're going to pay for it one way or another. If you're using that plan, you'll end up paying for your coverage. Those are the style of plans where you'll have copays when you go see your doctor. You're going to have a little bit of a higher copay when you see a specialist, and then you may have some copays when you have services done or coinsurance. So the difference between the two, copay is a set amount and coinsurance is a percentage. Okay, so as you use the plan, you'll be paying some dollars out. We refer to that as cost share. So those plans are the networked plans. So for an example with Kaiser, Kaiser wants you to stay in the Kaiser system. If you need to see a specialist or want to see a specialist outside of Kaiser, you have to ask their permission. I hate to say it, but a lot of times they'll deny that. You really have to have a strong argument why you might want to go see someone outside of their network. But most of the other Medicare Advantage carriers, give you a couple examples: Aetna, Humana, United Healthcare, Primera. Their networks are going to be different. They don't say you can only go to a United Healthcare provider, or excuse me, hospital, because the hospitals will all take a variety of different insurance plans. The key is who that provider itself is contracted with. When we look at networks, we look at really strong networks. If I'm going to look at a carrier for somebody, I want to make sure that there's lots of places they can go. So for an example, with United Healthcare, you don't have to stay, say, with the Virginia Mason system or with the UW system. You actually, there's doctors that are contracted with United Healthcare in all of them. So you have a very strong network with some carriers, and some carriers not so much. Humana for quite a while was not contracted with UW. So if you were seeing any UW physicians, we wouldn't ever want to put you on a Medicare Advantage with Humana. That's not true now. They are in the network, but that gives a good point as to things that you want to look at when you're looking at a network itself. Difference between an HMO and a PPO. An HMO is a health maintenance organization, and it says you need to stay within your network, or if you go outside of your network, you're going to pay 100% of your cost. So it's really important to make sure that you are in network. And again, that's why a strong network is important, making sure you have good opportunity to go see that specialist if there's one that you need to go see. Having a strong network means the likelihood of that specialist taking your insurance is going to be there. A PPO is going to give you service inside your network and outside. You'll pay more when you see somebody outside of network, but it does mean that the insurance company is going to help pay for those costs. So why would somebody choose a Medicare Part C over original Medicare? I do have some folks, if you see, I'm going to make this a little bit bolder, so I don't know how everybody else's eyes are, but there's something down here. You've got your A, your B, your Part D, and there's something called extra benefits. Okay. So when we have original Medicare, there are no dental benefits. For some unknown reason, Medicare does not see dental as being something that's important or a value for folks. So when you have original Medicare, you get your dental coverage separately. But on Medicare Advantage plans, you have an opportunity to potentially get some extra dental benefits with those plans. Why is that? Well, that's not coming from Medicare, it's actually coming from the individual insurance company. So basically these carriers all want to entice to get your business. So what can we do? We're going to stay within our guidelines of Medicare, right? We have to do the things that Medicare says we have to do, but we can entice you over with some extra goodies that you wouldn't get if you only had original Medicare. And dental is one of those benefits. So some carriers will have a dental benefit, some might have extra vision, transportation benefit, maybe an over-the-counter opportunity, variety of different things. And so for a lot of people, they look at Medicare Advantage and say, low dollars up front. I can afford my copays as just, as I use my plan, and I really appreciate having those extra benefits. But again, remember that the individual insurance company is managing your Medicare. And on those plans, most, not all, you need to work with your primary care physician and get referrals when you go off to go see a specialist. Okay. It isn't true with all of them. We do have one carrier that is an HMO that you do not have to get a referral to see your specialist. But I will tell you, for most of the plans, yes, you need to do that when you're on that structure. Okay, again, that's a lot of information. Try to simplify it, but do I have any questions on that?
Yes, we do. We have one question.
Perfect.
Age 65, contributed HSA until May last year. Still working. Is it wise to sign up to Medicare Part A as soon as 6 months past my last HSA contribution? Can I do that?
Yes, you can. Yeah. Yes, you can. You can't continue to contribute to an HSA and take your Medicare benefit, but if you've stopped contributing, you can go ahead and take your Part A. And if and when the time comes that you're going to go ahead and transition on to Part B, you can use your HSA for that or toward the insurance plan that you choose.
Great, thanks.
Yep. Oh, it's got to be more questions out there.
Not yet. People might be furiously typing, but not yet.
Okay, so what I want to talk about a little bit about your timeframes to enroll, and then also when you're making a choice, what you would do, and also your opportunities to make changes, because I think a lot of people have a misnomer that oh my gosh, I'm transitioning onto Medicare and I have to pick the thing it is that I need to have, and a lot of folks think you're going to have that for life. So let's talk about some options. So the traditional time frame, like I said, is turning 65. So if you do not have a spouse that you're going to be on their work plan, or you don't have individual coverage through your employer, and you need to transition onto Medicare, when you are turning 65, you have that 3 months before your birthday to apply for your benefit. You have the month of your birthday, and then you have 3 months after your birthday. So you actually have a 7-month window to apply for your Medicare benefits, okay? Your Medicare benefit, if you're going to take your benefit for age 65, it will start, your Medicare can actually start the very first day of the month of your birthday. So say, for example, your birthday is December 12th. Well, your Medicare benefits will start December 1st, unless your birthday is the very first day of the month. And if that's the case, your Medicare benefits will actually start the first of the month previous. Most people don't know that. I feel bad for those that their birthday is the second day, because too bad, yours won't start until that first, your birth month. Again, when you are turning 65 and you're applying for your benefit, the easiest way to do it is ssa.gov. Okay. So you also have that time frame that you can apply for benefits when you're retiring. So you've had your work plan, you've decided that now it's time for me to transition onto Medicare. There's 2 different ways that Medicare looks at that. Somewhere along the line, it shows you have a 7-month window to go ahead and transition onto Medicare after coming in your work plan. Other things look and say a 63-day window. Yes, you have that longer time frame, but I am of the rule of thumb, don't wait past 63 days because nobody wants to be without insurance. There's no reason not to get on to Medicare within that time window. So I always use the 63-day rule. That's my own personal that I do with my clients. You have opportunity when you first enroll. You can go into any plan you want to. You can go into traditional Medicare. You can take a Medicare Advantage plan. It doesn't matter. Your health doesn't matter. I know there's a lot of folks who think, oh my gosh, what am I going to do? I have this diagnosis. When you first enroll into Medicare, you have the availability to choose anything that you want to. And then you always have opportunity to make changes. So as some of you may know, right now we're in the world of the annual enrollment period for Medicare. So October 15th through December 7th is an opportunity for anybody who's on Medicare currently to make changes to their plan. So if you had traditional Medicare and you're separate prescription drug plan and you decided, hey, I want to try a Medicare Advantage plan, you can do that. You can make that change during this time frame. If you have a Medicare Advantage plan and you want to move to traditional Medicare, you have that opportunity to do that this time frame as well. You can change your plan as many times as you want to during this time of year. And I know it sounds silly, but I've had clients that have done it for whatever reason. Yeah, I want to do this. Oh, I changed my mind. I want to do that. Oh, I just found out about this. Oh, my diagnosis just happened. But whatever it is that Medicare sees in the system at midnight on December 7th is what you will have in place January 1. Okay. Medicare Advantage plans and prescription drug plans are both contracted plans. We get into the plan when we're turning 65 or when we're retiring, and we can make those changes now. And those plans will run from January 1 through December 31st. Okay. There's another opportunity most people are not aware of, January 1 through March 31st, and that is what's called the open enrollment timeframe. And during open enrollment, anyone who has a Medicare Advantage plan has an opportunity to change that Medicare Advantage plan once, either moving to a different Medicare Advantage plan or moving on to traditional Medicare. That's a really great rule that a lot of people do not know is available. Sometimes in AEP, you get busy. I've had some clients that have had hospital stays or just thought they did something that they didn't do, and you still have that opportunity during those first 3 months of the year. Or I had it happen with a client that her doctor retired on her, and the doctor that she wanted to go to next didn't take the plan she had. So we had that opportunity to change the plan. So it's kind of nice to know that we have that window. I like to tell people when you're on Medicare Advantage, you have an opportunity, not just once, but twice a year to make a change to your plan. So again, during AEP, October 15th through December 7th, your change would take effect for January 1. But if you made a change during those first 3 months of the year in January, your plan would be effective February 1. In February, it would be March 1, et cetera, till April 1st. And then after that, you're in that contract and that's where you're going to stay until the end of the year, unless we can trigger what's called a special election period. So a special election period gives us that opportunity to make some changes to plans. You could, somebody who's receiving Medicaid benefits has a special election period during the year, so they could make a change. There are folks who are in assisted communities, depending on the services that are given in those communities, have an opportunity all year long to make a change to their plan. If you're moving from one county to another or one state to another, again, you have a special election period, so an opportunity to change your plan. And let me give you an example as to why you might change from, say, a Part C plan over to original Medicare. I have clients that are what we refer to as medically needy. They're in and out of that doctor's office a lot, maybe having surgeries, a lot of physical therapies, a lot of services, right? And as we talked about, they're less expensive up front, but you have those co-pays and that co-insurance as you're using your plan. So in those cases, sometimes it actually behooves people to move over to traditional Medicare, where they're going to pay that higher premium up front. But as long as they're using their plan and as many times as they're having that physical therapy or doing any of those services, they're still only going to pay that one premium each month. As we age, unfortunately, we have those likelihoods of maybe having that fall. We're going to break something. We're going to end up in skilled nursing. So there's a misnomer that those skilled nursing communities want to get you out of there sooner than need be. When folks are on a Medicare Advantage plan, your first 20 days in that skilled are going to be at a zero copay. You're going to pay a copay day 21 forward. And so the skilleds are trying to get you out before you have that copay. Not that they're trying to get you out before you're ready, but they don't want you to have those copays when you have that Medicare Part C plan. So again, when you're older, you're a little more medically needy. Having traditional Medicare is a little smarter because you don't have that same rule on those first 20 days in skilled on original Medicare that you do on a Part C plan. Does that make sense to folks? When we're doing this scenario, I can't see heads nodding or any glassy eyes that are saying, hey, I have a question. So how are we feeling over there?
I don't see any questions in the chat quite yet.
Oh, you guys are good. Either that or everybody's really quiet and didn't have their coffee this morning.
Or you're just explaining it all really, really well.
Not my first rodeo, so thank you. All right. No questions? I much prefer Q&As. There's got to be something out there.
I'm not seeing anything yet.
Okay. Julie or Tina, any scenarios that you guys know of that would cause any questions at all?
That I can think of. I think, you know, one of the things that what you just talked about folks being in skilled nursing and how that's covered is really helpful for me to know, because I get that question a lot from folks.
Yeah,
that, you know,
absolutely. Okay, so let me look here. I don't think this is just verses. I'm actually gonna, if everybody is good, I'm gonna stop sharing my screen. One of the things I want to talk about is, you know, the importance right now of this annual enrollment period and the value behind reviewing your plan every single year. So I really, really strongly encourage folks to do it. So I talked about the Medicare Part C and the Medicare Part D plans being contractual. Okay, so what does that really mean? It means that on those plans, the insurance carriers have opportunity to make any changes they want to during that in that contract. Of course, they're working with Medicare. They have to have approvals to do the things they're doing, but it means that premiums can change. It means that deductibles can change. It means copays can change. Your maximum out of pocket, the formulary. What's a formulary? That's the way we look at medication. So you're going to have anything from tier 1, 2, 3, 4, or 5 medications. Your tier 1 and 2 are going to be lesser expensive. Your generics, preferred generics. Your tier 3, 4, and 5s are going to be more expensive. So if for nothing else, this is the time of year to look at your Part D, be it in an individual Part D plan or on a Medicare Advantage, and say, okay, these are the medications I take. What's this looking like that it's going to cost me for next year? You always want to look at that. I use Medicare.gov. It's the only way to go through. You use the algorithm. You put your zip code, your medications as you're taking them, frequency and dosage. Hit that button and Medicare will spit out and let us know what's going to be that best plan for you based on which pharmacies that you prefer to use. So from one year to another, again, those contracts change. I'll give you a scenario right now. We have a Part D plan, a separate Part D plan that my folks on original Medicare have been using. And for the last couple of years, it's been a great plan. Ballpark been around $12, $14 a month. The formulary's been great. But this year, they made a significant change. The insurance company was purchased by another company. And instead of just offering that one plan, they're now going to offer 2. So, hey, by the way, they sent the information out to everybody that said, if you do not do anything with your Part D, we're going to roll you automatically into a plan that's moving from $14 into a $32 premium. If you'd like to make the change, you can call us and we can go ahead and put you on the other plan that we're going to offer. That's going to be $14. It's kind of important to look at that contract, right? Because nobody wants to get rolled into something that they really don't need and end up paying $20 more a month for something that rightfully they really could just make that phone call and move over to the $14 plan. That might sound a little confusing, but I'm hoping what you get out of that is the fact that you got to read your contracts, okay? We had years ago, we had a Medicare Part C with United Healthcare for 8 or 9 years. It was a 0 premium. And one year, a number of years ago, they decided to put a $55 premium on it. Well, if you didn't do anything at all, you were just going to roll over and I wasn't paying a premium. And now all of a sudden I am, right? You got to pay attention to your contracts. So that's why it becomes a little bit busy right now. We're just looking at everybody's prescription plans, looking at everybody on Medicare Advantage. Has the carrier, is the carrier that I'm on right now, are they going to make any big changes, anything that's going to better my situation? Or, hey, I've been healthy, but all of a sudden now I'm not. What should I do? So it becomes a bit of a little hectic time frame trying to get everything done for everybody, but really important. And I strongly advise people to review their plan once a year.
All right, we do have a couple questions.
Okay.
First is, I'm curious about long-term care. How would that work for my elderly dad to get him into a facility?
Oh, well, hopefully he had long-term care before he needed to have long-term care, because the insurance companies don't want to give it to you. It's kind of like the car insurance, right? You can't wait till after the accident to try to get the car insurance. So, long-term care is fantastic. I highly recommend it because it is going to help offset some of the costs that you might pay if they do need to move into a community.
Great. The next question, in order to sign up for C, you have to sign up for A and B, correct?
Correct. Yep. Yeah, no matter what, whether or not you're doing a Medigap plan or you're doing a Part C plan, you do need to have Medicare Part A and B in place. So regardless, I always tell everybody, no matter what, you're going to have to pay that Part B premium, and then you're just going to have to add on whatever it is you're going to pay outside of that.
Great. That's all the questions we have so far.
That's it. Oh my goodness. I don't know that I've ever talked to a group that's been this quiet. I choose to believe they can't find the mute button to unmute themselves. Okay, so let me share one other thing with you that is actually really great here in the state of Washington. So I should have specified early on to let you all know that Medicare is a federal program. Okay, so we have Medicare rules that are throughout the whole states, but we also have state-specific rules, and we have individual insurance company rules. Okay, so they don't all work together. Sometimes you end up having a rule and you're going, but Medicare says, but the insurance carrier says, this is, so we kind of have to look at all of those. So Medicare being a federal program, again, there are some things that are statewide. Okay. In the state of Washington as an individual, though, what's kind of cool is we have something that's very unique that no one else has throughout the states. There's a very small handful of states that have something similar, but we have a rule. I talked about, changing that prescription drug plan or changing your Medicare Part C plan, but I didn't talk about changing your Medigap plan. So in the state of Washington, our insurance commissioner encourages people to shop around their Medigap plan, price comparison. Kind of like what we do at the grocery store, right? We go to the grocery store. I don't want to have to pay so much for that can of peaches over here. If I go get it at this store over here, I'm going to have the same exact can of peaches. It says Dole on the label, but I'm going to spend a lot less on it in a different store. Well, Medigap plans are all the same. They are federally mandated plans. So if you have an F plan or a G plan, which reminds me to remind you about that 2020 rule, no matter what insurance carrier, it's going to be the exact same because it's federally mandated to be the same. But different insurance carriers are going to charge a different price for it. In the state of Washington, we can shop our plan anytime we want to, no matter what time of year. So a lot of people have that misnomer that, oh my gosh, I can only change it during AEP, not in the state of Washington. So I have some folks who are paying, $250 for a plan that I can actually switch them over to another carrier, and it can be under $200. And so that's a nice size savings for folks. So I can do that anytime I want to during the year. So I have this thing I always say, to review your Medicare. Doesn't matter what time of year you do it. I may or may not be able to make the change when I'm reviewing it, but there's always a value to review your plan. So that 2020 rule, let me talk to you about that really quick because I don't want to forget that one. So on the Medigap side, F as in Frank has always been our top plan, or actually has been for the last number of years. I and J have gone away. Most people don't even know they existed. Someday F's going to do the same thing. But F basically said, pay a high premium. Your Medigap plan is going to take care of everything remaining that Medicare does not. So all of the deductibles and co-insurance, if you only had Part A and B, that insurance plan, the Medigap plan, would take care of all the remaining costs, okay? But the new rule for January 1, 2020 said anyone who's newly eligible for Medicare after January 1 of 2020 was not going to be able to get the F plan. That F is in Frank. Your next plan is going to be G, G as in gopher. And the only difference between those two plans, first of all, is with the premium that you're going to pay. You're going to pay less for a Part G. No two ways about it. Your premium's going to be lower. And you're going to pay your Part B deductible yourself. So instead of saying, I'm going to pay a high cost for the insurance company to pay that deductible for me, I'm just going to pay for it on my own. The Part B deductible this year is $195. It's not a huge deductible. So when your premium is going to be lower and you're going to take responsibility to pay that deductible yourself, you have an overall savings. So actually, even before this rule came about, I always encouraged all of my clients to be on that Plan G. Again, lots of information. Hopefully that I didn't go over heads too badly.
No, I think you've done a great job.
Okay.
I did get a comment saying that you've done a great job explaining it, so thank you so much.
Yeah, thanks. Like I said, I can talk about this for forever, so I can keep on going, or I really welcome questions. So if anybody has anything at all.
Sure. I would say we got another 5 minutes or so.
Okay. All right. So we talked about AEP, we talked about OEP, we've talked about the special election periods. We've talked about moving the different plans. I mean, we've really covered a lot. I really am surprised though that I usually do get quite a few questions that kind of starts veering me off in a variety of different directions. Let me just say, I think one of the things that's super important, and anybody is ever transitioning onto Medicare, really, really important to always look at what plans your doctor accepts. Always look at your medications, always look at the networks, and then utilization of the plans, especially when you're looking at Medicare Advantage plans. A zero premium plan, you've got lots of carriers who offer zero premiums, but what I do when somebody says, I just had a phone call yesterday with somebody who said, I'm healthy, I don't see a doctor a lot, I don't want to have to pay for a plan if I don't have to, I take no medications, what do you recommend? Well, I have one go-to that I like to go to, and it's because of how they do their extra benefits. So not only that, but when you look at that zero premium plan compared to another zero premium plan, if you were to use that plan, your co-pays and your co-insurance are actually going to be less on that particular zero plan versus another. So always make sure that you're looking inside those plans as well. Okay. And again, those insurance carriers are always going to offer you those extra benefits to entice you over. And some of those benefits are better than others. Well.
Oh, question.
Okay.
Is all of that info on the Medicare site?
Medicare.gov is a phenomenal website. Yes, you're going to get all of that and more. You might have to read through things. A lot of times people say, I got all this information, I'm trying to dissect it. It's a little confusing. Absolutely read about it, but have a question with an agent. Like I said in the very beginning of my intro, I'm a licensed agent. I highly recommend that folks actually use an agent. One of the things about us, for myself, I live and breathe Medicare. I'm writing it all the time. As agents, we have to certify every single year to sell Medicare products, meaning I have online courses I have to do every single year. And with each individual insurance carrier, I have to take their online courses and pass tests for those too. So we know a little bit more than just reading the basic manual. And we also work with the everyday scenarios, right? I get things all the time that kind of puzzle me. And then I have to do investigatings to find answers. So I tend to know a little bit more than the average person. But truly, I do think there's a value when you work with a licensed agent. But the Medicare.gov site, let me tell you one thing about it I really do appreciate. You go into the search engine on Medicare and type in whatever it is your question is, it's going to pull up the information for you. So I always tell folks that that search engine is, it's a really good blessing. Government website, they did it right on the Medicare site.
Great. Another question, how do you find agents? How much do they cost?
If an agent is charging you money, you're not working with the right agent. So as insurance agents, we get a commission when we write an insurance plan. So if you're going somewhere, I've had people tell me, oh, I went to go listen to this presentation and they charged me for a booklet. I'm like, don't go. That's just their way of trying to get money out of you. Everything that you would need, you're going to be able to get for free. So I am a licensed agent. Feel free to reach out to me if you'd like. You can always call Sheba, which is through the insurance commissioner's website. Sheba folks are not licensed agents, but they are volunteers. They can offer you some good information. I have some great referral sources, and I'm sure there's several people at Era Living that also know of other agents that they could refer you over to. Again, remember, if an agent's charging you money, you don't want to use that agent.
Great, that's wonderful. And if any of you folks have questions about getting in contact with Karen, you can email me. You can just respond to that email that I sent out yesterday. Karen, that's great.
Good. Excellent.
Thank you so much.
You guys are very, very welcome. Absolutely. It's my favorite subject. Can you tell?
Yeah. All right. Well, if there's no other questions, I think we'll go ahead and wrap it up. Again, I'll be emailing copies of the slides along with Karen's information to all of you. So thank you so much, Karen. We really appreciate your time, and I appreciate all of you for joining us today. And I think that's it.
Excellent. You're welcome. Everyone have a great day.
All right, Karen, thanks so much.
Thanks.
Bye-bye.
Right.